Lots of questions about the cost of dental implants. So what affects the cost?
Look, there's a lot of different factors, okay? Number one, it's the number of doctors that are working on your case. If you're going from office to office to office and different locations, different doctors doing different procedures just to get those dental implants put in, that's going to cost more.
Is that how it's typically done? Like you go to one doctor that does the surgical part, then you go to another office that puts the teeth on top.
Right.
So you do both parts.
Correct. One doctor, one fee. That way you're not double spending. You're not double spending. Yeah, that's exactly right. The second thing is the type of implants that's chosen. A lot of times you'll see there's small implants, mini implants, implants made FDA approved, not FDA approved. There's so many different variables. We use high quality implants that are really high quality that last a long time.
They're guaranteed.
They're guaranteed. Okay. Now, some offices will use an implant that's made in China, made in other...
There's ways to cut corners?
Ways to cut corners. So we want to make sure what type of implant are you getting, what brand and quality is. My patients, if they get an implant, if they move to Florida, if they move to California, if they go to Europe, everyone knows what that implant is. It's universal.
You're using the gold standard?
The gold standard. It's the gold standard of implants, yes. There are even implants that are for certain types of bone, that are limited bone, that people that don't have enough bone, where you can use those implants and that'll affect the cost too, or lower the cost. That way you don't have to get all this bone grafting done.
Okay. What else affects the cost?
The other is a lab bill. Some offices will send everything out to a lab somewhere that's charging triple, quadruple prices, and that's going to affect the price for the patient.
Did you used to do it that way?
We used to do that many, many years ago. Now we have an in-house lab. We're able to work with our lab technician in-house to get the cost down for us, which will in turn pass the savings on to the patient.
Now, when you say that you mill or print the teeth right in your office, what does that mean?
It means we're able to utilize the technology. We have the machines ready to make the teeth for us.
So they just digitally print them?
Digitally print them. They're customized. They're made for your mouth, and they're colored and they're shaped and everything. They're all specialized for you. But that lowers the cost because we're able to do it in house.
Is that why you do it so quickly as well?
Yes. The next is insurance covers.
Yeah, what does insurance cover?
You know, Medicare, Medicaid, those insurances, they don't cover anything. They don't cover implants at all.
Okay.
There are some insurances patients have that with their jobs that may cover maybe $1,000 to $2,000 max, and that's okay. Most patients have that. They might have $1,000 or $2,000 on their insurance that we can help them maximize. We can help them get. But for the most part, we have financial plans that we can use, payment plans that we have. There's no money down. You apply for it. If your credit's good, you can get the financing.
Would you say that most people finance the big procedures, like getting a new upper lower set of teeth with implants?
I would say about 99% of my patients do finance.
Oh, really?
Yeah. It's very common. It's very usual.
So you kind of set it up for them?
Yeah. When you come in the office, we're able to do all of that for you. In the office, you don't have to do anything at home. You don't have to fill out any paper. You come in. We have someone that specializes, that sits with you. It's your advocate, your treatment advocate.
You have to have OK credit.
You have to have.
Do they accept co-signers?
They do. If your credit's not great, then we always recommend having a co-signer come with you to your appointment that can sign the application for you. If you have decent, good credit, you'll get approved. Everyone gets approved. Yeah, another thing we see online that it can be very confusing for patients is they see ads for implants. They say, well, oh, wow, this office is doing it for so much cheaper. Let me go there. But do you know what you're getting? Is it a snap indenture or is it permanent teeth?
I showed you, we talked about this in my green room, and most of those fees were based on snap indentures.
Yeah.
But it seemed like you were getting a full set of teeth that don't come out.
Yeah, in our office, we're giving you a full set of teeth that stay in, that feel like natural teeth. Some offices will use plastic material, plastic dentures. They're just, they're cheaper and they're charging less, but you know what? They're not getting what you're supposed to be getting, which are permanent teeth.
So the gold standard in dentistry is this zirconia teeth?
Absolutely. Zirconia teeth.
Is it because they're stronger or they look better?
Both. They look better and they're stronger. So we have both things going on really well now with zirconia.
Okay.
The next thing that affects the cost is the extent of surgery. How much surgery does a patient need? Do they need bone grafting? Do they not need bone grafting? All this is factoring. That's why it's important to come in. We can take a look and see what exactly the patient needs.
Okay.
Finally, last but not least, is the surgeon's experience. This is a big, big thing. You know, some patients, if they see a doctor that's not experienced, what's going to happen is they're going to be going to those visits over and over and over again. It can take years. Sometimes I've seen patients take over 2 years in other offices. They come to me, they go, Doc, I didn't know you can do this in one visit. The answer is yes. With the experience, the technology, all of these things factor in the cost because we want to make sure that we give the best cost to the patient and they get the best product. How do we do those two things? We marry those two things together. Have the best technology, have the best experience, because with experience, is very important. It brings in success. When you have good experience, you have good technology, you marry those two things together, it's a win.